Introducing the hyfin chest seal from North American Rescue. The hyfin chest seal is a self-adhesive occlusive dressing designed specifically for use in the management of casualties with penetrating chest wounds. The hyfin utilizes the latest specialized adhesive technology in order to achieve and maintain a superior seal under the most adverse conditions. The hyfin is supplied in a rugged, easy-to-open foil package that allows for quick and effective application in extreme environments. After action reviews from numerous healthcare professionals identified the recurrent requirement for an occlusive dressing that effectively adheres to a casualty's chest wall, the hyfin chest seal was developed, tested, and validated through an extensive collaborative effort with these providers to achieve this requirement. The hyfin chest seal meets the Committee on Tactical Combat Casualty Care's current guidelines for managing all open and/or sucking chest wounds. A penetrating chest wound creates an opening in the chest wall through which air may enter the chest cavity during the normal respiration cycle. Commonly referred to as a sucking chest wound, this injury results in a condition known as an open pneumothorax. An open pneumothorax occurs when there is a persistent communication between the internal thoracic cavity and the environment through a defect in the chest wall. Though this interferes with normal physiological ventilation, it should not create a tension pneumothorax, as the intrathoracic pressure and the atmospheric pressure equalize across the open wound. A tension pneumothorax can develop with a sucking chest wound, when the chest wall defect creates a one-way valve in which air can be drawn into the pleural space but cannot exit. Since the air cannot escape, the intrathoracic pressure increases, and a life-threatening tension pneumothorax can develop. The initial management of an open and/or sucking chest wound is to immediately apply an occlusive dressing to cover the defect and secure it in place. Traditionally, an occlusive dressing secured only on 3 sides has been used to seal penetrating chest wounds to help in preventing a tension pneumothorax from developing. Other types of chest dressings, some which contain pressure relief valves, are also in use, but there is little clinical evidence to show that any of these, or even the traditional 3-sided dressings, are superior to a completely occlusive dressing placed over the wound to cover the defect. Bleeding from the wound site, continued sweating, body hair, and other environmental contaminants may significantly limit the effectiveness of adhesive devices not designed to overcome these adverse conditions. The hyfin chest seal was designed with superior adhesion capabilities to conquer these challenges. This casualty has sustained a penetrating chest wound to his anterior chest with no exit wound. His lung has collapsed, and it is interfering with his ability to breathe. He requires the immediate application of a hyfin chest seal. These wounds are rapidly treated by applying a hyfin chest seal during expiration, placing the casualty in an upright position or in the recovery position, and monitoring his respirations for the possible development of a tension pneumothorax. Step 1. Wipe any dirt and/or fluid from skin with sterile gauze pad. Step 2. Grip large white flap and peel clear liner from dressing. Step 3. Place dressing on patient, adhesive side down, centered over the wound. Step 4. Peel and remove small white flap. Step 5. Firmly press dressing to skin, forming an effective seal. Position the casualty in either a sitting position or the lateral recumbent recovery position. Because air may still enter the chest cavity through the damaged lung tissue during the normal respiratory cycle, the attending medical provider continuously observes and monitors the casualty for signs of progressive breathing difficulty that may indicate the development of a tension pneumothorax. If the provider becomes concerned for a developing tension pneumothorax, they should follow their training and established protocols to treat this condition. supporting tactical and pre-hospital healthcare professionals worldwide, and enhancing casualty survival by providing superior products designed specifically for austere environments, is our mission and our privilege.